asking questions on behalf of law enforcement, Matt Clay, the Deputy Sheriffs Association of San Diego County. Matt?
Thank you, Mark. Good afternoon, gentlemen. My name is Matt Clay. I'm the president of the Deputy Sheriffs Association of San Diego County. Our association represents 2,300 sworn deputies of the San Diego County Sheriff's Department. For 60 years now, the DSA has been the strength behind the badge, supporting San Diego County deputies, their families, and our communities. So far this year, sadly, 80 police officers have lost their lives in the line of duty nationwide. In our recent past, 2 deputy sheriffs were shot in the line of duty while attempting to arrest an accused child molester in Lakeside. And even more recently, 2 deputy sheriffs were shot in the city of Encinitas by an individual with a history of mental health concerns. In fact, mental health issues and their effect on public safety have become a growing concern of ours. As mayor, how will you prioritize and help resolve mental health issues in San Diego?
And David, you'll be the first to answer this question. And might I punctuate this by just saying that in my experience now out on the streets as well, I would even punctuate what he said in terms of mental illness. We're finding in El Cajon, where I'm working lately, for example, calls for service that deal with the mentally ill are up 40% in the last year. As many as 3 out of 5 calls deal with people who are dealing with some kind of mental illness. So I can only punctuate that all over the county that is probably a continuing problem. So your question to answer, sir. And again, these are 1-minute questions now.
Thank you, and thanks for sharing the question, Matt. And I think we need to look at this holistically. We obviously here are talking about law enforcement issues, and we'll focus on that. But at the end of the day, we function better as a city and as a region if we take care of the people. And we have not been taking care of people, whether it's those who have illness, who are not being diagnosed, who are not being treated, and who are not being cared for. And this is why we're asking officers to do a lot more with a lot less resources, a lot less pay, and that's why it's critical that we treat officers appropriately and that we pay them the appropriate compensation to do this work. Because unfortunately, the rest of government is falling through the cracks, and the services that they're supposed to be providing is not being provided. And so we've got to engage our county mental health system. That is the arm of the state that's supposed to be providing the services for those who have challenges, have mental illness, or who need support. And we got to engage them and do an approach that they are more proactive with the services they provide.
All right, thank you. Kevin Faulkner?
Thank you. It is a partnership, and it has to work even better with the city and with the county. I've spent a lot of time, particularly on homeless issues, in part of the district that I've represented for a long time, the downtown, with our homeless population. With many of them are duly diagnosed, both mental illness and substance abuse problems, drug and alcohol. And we knew it was a priority because it affects everything we do. It affects our quality of life. It certainly affects our neighborhoods. And we need to make sure that we're providing the services for those individuals that need help. And so we did a model program. The Connections Housing Program was not just about emergency beds. It was about providing the services that these individuals need to transition them off the street. It was a tough thing to do, and I took a lot of heat that people did not want us to do that. They said, we don't want another service. And I said, no, we're going to bring together everybody together who even opposed it. And we started that in downtown San Diego. It is working. We're providing counseling services, medical services, transitional beds. It's all of that to knowing that it's just not an emergency bed situation. It has to work with all of us. We've done that as a model. We're going to expand it to other parts of the city, and that'll dramatically help our officers who are on the homeless outreach team and in every neighborhood that is trying to provide those services.
Nathan?
Yeah, Matt, you started off by talking about the number of officers that have given their life, and I had a job for years where I know what it's like for folks to put their life on the line. I know what it's like to lose your closest friends, to see them fall in the line of duty. And there's nothing you wouldn't give to bring them back, even if just for one day. There's nothing you wouldn't do. But we know all of those officers who are commemorated on the walls here in the Hall of Valor, there's nothing we can do to bring them back. But there is something we can do to take that energy and that grief and that sorrow and channel it towards making them safe. And so I won't tell you what I'll do on mental health issues, I'll tell you what I've done. When I authored Chelsea's Law, it would have been easy to just jack up penalties, but we did the hard work of diving into this mental health issue, and we found the Mentally Disordered Offender Act had serious flaws and was broken. And we fixed those flaws. For those that are going to get released, we ensured that there was treatment and monitoring and that mental health was taken seriously when we consider not only incarceration but levels of treatment and level of attention that they get. And that's the type of approach that we need to continue to bring, a real commitment to protecting our officers and doing everything we can to help make them safe.
Thank you. Mike Aguirre.
Thank you. You know, as the chief law enforcement officer for the city, for the time that I was in the city attorney's office, I saw the kinds of, what we ask our police officers and our law enforcement to do is to do the dirty work, to be on the front line and to get their hands dirty with the rest of us kind of looking on. What I would like to see us do is have caseworkers assigned to the homeless so that we can actually proactively manage them. And I will come over and I will meet with the sheriffs and meet with our chief to see what we can do to have a more proactive civil commitment enforcement effort so that when we identify those that are clearly risks to our police officers, that we take commitment actions and remove them so that they're no longer on the street and no longer a threat to our officers, amongst other things that I'm open to in order to enhance the safety and the protection for all of you. Thank you.
All right. Thank you very much.